The CONPET study is a study in first-line treatment after ASCT, and we only had patients which were in VGPR response or better. So all the patients were in good response. And what we did was we did PET-CT scan in these patients, and patients were divided if they were PET-CT positive or PET-CT negative. And if they were PET-CT positive, we gave them additional treatment with 4 cycles of KRD. And if they were PET-CT negative, they were just followed by standard treatment. And after the 4 cycles of KRD, we repeated PET-CT. And we also did MRD before and after KRD treatment to correlate with PET-CT. And what we found was that 33% or a third of patients were actually PET-CT positive. And we must bear in mind that these are patients in VGPR or better, so we found quite a high rate of PET-CT positive in patients. And after KRD, we managed to turn 33% of these again into PET-CT negativity, showing that PET-CT is a dynamic response technique. And as for correlation with MRD, we found that 55% of PET-CT positive patients were actually MRD negative. So MRD and PET-CT are complementary techniques. You can be PET-CT positive and MRD negative. And you can also, from previous studies, we know that you can be MRD positive and PET-CT negative. We are following patients for progression-free survival and overall survival. It will be very interesting to see if the PET-CT positive patients do worse than PET-CT negative patients, and if KRD treatment helps them. As for the EI in general, it was so many interesting topics and teams to follow, so I'm looking forward to the rest.